passed on from one generation to another often go undetected until something devastating happens. In today's Wellness Wednesday, a new research project is aiming to help families detect, also prevent those diseases before problems turn serious. What was supposed to be a relaxing time
I was on vacation. I left Idaho, went down to Utah.
Turned into a life-changing event for Brady Ulrich.
We had just checked into our hotel.
After bringing luggage up 2 flights of stairs,
And I was just laying on the bed and I couldn't catch my breath. I couldn't breathe.
he knew something was wrong, serious enough to go to the local emergency room, where the doctor told him he had pneumonia, but the first assessment was wrong.
The second doctor comes in and he says, "You don't have pneumonia, you have severe congestive heart failure."
Brady was 38 years old at the time, living what he thought was a healthy life, not knowing the severe, even life-threatening deficiency.
At that point, my heart was functioning at 20%.
Bryce Moulton, director of clinical research at Intermountain Healthcare, is currently leading a study to discover people who may have an underlying inherited disease.
The hereditary study is a population genomic study that's being conducted here in Utah. We can essentially predict or prevent that disease from ever occurring in future generations.
In Brady's case, his heart failure was passed down through his mom by a gene mutation. News revealed by a series of tests, which then prompted even more, this time on his family members.
Through genetic testing, I was able to find out that unfortunately, I actually passed this gene mutation onto 2 of my 3 children.
To date, over 60,000 participants have enrolled in the genetic screening study, making it one of the largest clinical research studies in the nation. With more participants wanted, which is a clinical accomplishment, but also a community service.
This is this type of study that will be a game changer. With the information that we're collecting from this study and the knowledge that we'll learn from this study, we will literally be able to save lives. We will prevent death and disease from happening.
Brady has since received a heart transplant.
I remember the first 2 or even 3 nights after the transplant, I was unable to sleep just because my heart was beating so loud. I wasn't used to hearing a heart beat that loud.
Now living life not only grateful, but aware for his children's future, one beat ahead of any potential problems.
I believe that early detection and early intervention, especially in a condition like this, is your best friend and the best chance you have.
Well said there by Brady. If you are interested in learning more about or even participating in the study, we do have a link to it on our website, fox13now.com.